Today in this video, I will talk about the symptoms and signs for gastric cancer patients. Bismillah. Firstly, the symptoms of gastric cancer patient. We have to know that the symptoms are non-specific. What I mean by this sentence, they depend on the sites and on the locations of the tumor and the stage of it. So, for example, if the tumor happens in the atrium, the patients will come with gastric outlet obstruction symptoms like projectile vomiting. Okay. The symptoms of gastric cancer. Firstly, I'm sure that you all know that you will find in 70% of patients with gastric cancer and epigastrium pain. Okay, epigastrium pain. So, let's draw the person with gastric cancer. How he or she would come to the emergency room or to the hospital. Okay, as a gastric cancer happen in males more than females, I will draw a male. This is just small hair. Okay, what he comes to the emergency room complaining of. The first signs, as I say, it is the abdominal pain, epigastric pain. So he puts his hand on his abdomen. Okay. This is the first symptom. What is the first symptom? Is epigastric pain. And the pain, you should know that the pain would be constant. So constant means that it won't be variable. It won't increase or decrease suddenly. No. It's constant. Okay, it's constant and severity. Also, the pain would not radiate to another site. It is localized pain, so it's constant and localized pain. Also, the pain not associated with food. So if I ask the patient, is the pain decreases when you eat, he would tell me no. Okay, so the pain constant and no radiation, localized. Plus, it is not associated with feeding, not associated with I'm eat so it is relieved. No. What? How can I write it? No, relieving with eating. Okay, so this is the abdominal pain. This is the gastric pain that most of the patients with gastric cancer come to the hospital with. The second symptoms, nausea, anorexia, and unintentional weight loss. And also it is something not a really strange or something suddenly, wow, why he comes to me with anorexia and nausea and intentional weight loss. And intentional weight loss, it's something related to any cancer, and so it's something common. Nausea and vomiting. So nausea and not vomiting, nausea and anorexia. So let's draw. Let's imagine this is a food, okay, in the dish. Sorry. Okay. So the patient don't like it, don't want to eat. The patients with anorexia. Plus the patients with nausea all the time. He feels like he wants to vomit, but he can't. What else? We say that he comes with an intentional weight loss. How can I draw it? Maybe I can draw it with, for example, with oversized clothes. So oversized clothes means that his clothes become larger than his weight and his body. Okay, it's between us, me and you. You will know this sign. This drawing, this art. Okay, what else? So he comes to me in emergency room with epigastric pain, a constant, localized, and no reduction or no relieving with eating. Plus, he come with anorexia and vomiting. How you can be sure what he means by anorexia? You can ask him, what is your favorite meal? For example, he would say, I like to eat tomato. So you ask him then, if I cooked a tomato and come with it, you would eat it right now or in the past week or for the last month. If he answers by no or I can't or something related to, like he can't even if it is the favorite meal for it. So yes, he's an anorexia. Okay. What else? I can nausea and an intentional weight loss. Okay. The third symptoms, which is the dysphagia. He feels difficulty with swallowing, with eating. This is another reason for anorexia. Anorexia will lead anorexia because of this dysphagia. Okay. So when he eat anything, it will be difficult to eat. Okay. And this happens when the tumor located proximally in the stomach. If the tumor located proximally in the stomach, this would what? This would make the inlet of the upper stomach closed. Okay, so this would come with difficulty in swallowing and maybe pain in swallowing. So the patients suffer from what? Suffer from dysphagia. Oh, patient. Okay, and dysphagia come with 20% of all cases of gastric cancer. 20% of patients with gastric cancer will come with dysphagia. What else? The fourth symptom of gastric cancer, it is the hemorrhage. 5% of patients with gastric cancer come with hemorrhage. And why would it happen, the hemorrhage? Okay, you can know that if the tumor in the stomach happens near to the blood vessels, it will compress it and it will make a pressure on it and it may be make a rupture, okay, on it. This will lead to what? This will lead to hemorrhage on the stool. So this may lead to anemia for the patients, okay? This may lead to to make him anemic patient. Okay, what else? What we said? Hemorrhage. Hemorrhage. 5% of patients come with hemorrhage. Okay, and dysphagia, 20% of patients. And epigastric pain. Okay, epigastric pain. Epigastric pain, 70% of patients. What else? Maybe 1% of patients with gastric cancer come with perforation. So the tumor make a perforation, and all the contents of the stomach will go to the abdominal cavity. May lead to peritonitis. Okay, so yes, and it is so يعني rare. 1% of patients come with perforation, uncommon perforation. Okay. Okay, so as I said, the symptoms are non-specific and depends on the locations of the tumor. So if the tumor on the proximal part of the stomach, it would come with difficulty in swallowing, dysphagia. If the tumor located near to the blood vessels, it will come with hemorrhage. Okay, may lead to what? To anemia. Okay, what about the late signs of gastric cancer patient? Firstly, we'll see cachexia on it. What is the cachexia? It's muscle wasting and body wasting. The body becomes so thin and the ribs are visible. Yes, this is the first sign. The second sign, it is abdominal mass. We'll see an abdominal mass. This is the person with gastric cancer. This is the abdomen fat of him or her. Okay, here we see a mass. This is the stomach. Okay, here will be a mass. This is the second late sign we would see on gastric cancer patients. The third one, we have to know that gastric cancer can metastasize through a group and collection of sites. So it can metastasize to the liver. The liver is here. Okay, so gastric cancer can go to the liver, and what we will see on the patients, we will see hepatomegaly plus jaundice. Hepatomegaly plus jaundice. Okay, here we can know that the gastric cancer make a metastasis on liver and cause hepatomegaly and jaundice. Okay, on the patient. Also, the gastric cancer can go to the supraclavicular lymph nodes. So let's imagine this is the clavicular edge. Here, the lymph nodes. So, what's the sign here? It's the Vercho sign. Okay, the Vercho node or Troisier signs. We call it Troisier signs and or Vercho, or Troisier's sign or node. Okay, so we will see on the patients also lymph adenopathy. Okay, on the left side, we'll see what? We'll see the Vercho or Troisier signs. What else? Where the gastric cancer can go? Gastric cancer can go to the umbilicus here. Here's the umbilicus of the patient. We will see on the superficial palpation, we can find, or may we find, a mass here. And this mass is called Sister Mary Joseph node. Sister Mary Joseph. Joseph node. Okay, it will be on the umbilicus here. And this is the side form metastasis of gastric cancer. So gastric cancer can go to the livers, to the lymph nodes, supraclavicular lymph nodes, especially the left one. Okay, and can go to the umbilicus, where it can go else. Okay. What if we do rectal digital exam or vaginal digital exam? We would find a mass. This mass would be on the Douglas pouch of Douglas. This mass would be on the pouch of Douglas, which is located between the rectum and the vagina and the uterus in females, or between the rectum and the bladder, urinary bladder in males. Okay, so the gastric cancer can go to the pouch of Douglas and make what's called plumber shelf. Okay, so we'll find on the rectal digital exam mass on the pouch of Douglas. It's called plumber shelf. Also, it's still when another sites gastric cancer can go to it, which is the uterus in females, and make a mass. We call it We call it Krakenberg tumor. It is a mass on ovaries. You will find a mass on ovaries. So let's imagine there. This is like that. Here on ovaries, we'll find mass, and we call it. This is mass from the gastric cancer. We call it Krakenberg mass or tumor. So the gastric cancer can make a metastasis to supraclavicular lymph nodes and cause what is known as Vercho or Troisier sign. It can go to the liver, make hepatomegaly and jaundice. Can go to the umbilicus, which with a mass called Sister Mary Joseph nodes. And can go to the pouch of Douglas between the rectum and the uterus in females, and between the rectum and the urinary bladder in males. And we can find it on rectal digital exam or vaginal ones. Okay, and we call it plumber shelf, and can go to the ovaries, and it is called Krakenberg mass on ovaries in females. And we will find abdominal mass, and we will find cachexia on patients with late stage of gastric cancer.